Good evening. I'm going to assess one of my students' letters today and provide the feedback. Let's start the correction and assessment of this letter. So you have written down the the addressee's details on the top. It's Miss Lucy Band, the registered nurse, the community health center, St. Kilda. That's good. So the addressee's contact details are written correctly, and then you have written on the date of the letter. All right, that's good. I'm happy with that. And then the salutation of the addressee. You have written, Dear Miss Ban. That's good. And then you have written on the reference details of the patient, which is Miss Amy Vineyard, aged 21. That's good as well. I'm writing to refer Miss Vineyard, who is a 6-week pregnant woman. Okay, I'm writing to refer Miss. Okay, all right. So what you should have done is that this is wrong. Okay, I'm writing. Otherwise, what you could have done is you could have put a comma. Comma here, and then you can define it. Okay, let me write down the correct sentence. Okay, I'm writing to refer Miss. Okay, I'm writing to. Sorry, capital. I'm writing to refer Miss Vineyard. Okay. You have written on is, I think, a 6-week pregnant woman.
Yes.
Okay, a 6-week pregnant woman. He is a 6-week pregnant woman. Okay, this is wrong. Okay, all right. Okay, let's say, and then you have written on requires, who requires supportive care and management. Okay, who requires supportive care and management. So this is the whole sentence, who requires supportive care and management. But unfortunately, this whole sentence is wrong. Okay, I'm gonna rewrite this sentence. Okay, what you could have done is you could have mentioned like this: I'm writing to refer Miss Vineyard, comma, a 6-week. Okay, a 6-week pregnant. Sorry, a 6-week pregnant woman. It's not WOMEN. It is WOMAN. Okay.
Okay.
All right. The one you have written on is incorrect. Okay. A 6-week pregnant woman, comma, who requires supportive care and management. This is good. Okay. This is how you should have written on the sentence structure. Do you understand this now?
Yes, sir.
Because we are actually defining this person. So definition can be done for a person between 2 commas. So between 2 commas, you can define that. A 6-week pregnant woman. And remember that, for a 6-week, your 21-year-old or whatever it is, like for all those things, you have to put an hyphen in between. So a 6-week pregnant woman, comma, who requires supportive care and management. Okay, so how do I know whether the definition is correct or not? Okay, it's very simple. You remove this definition and then read the remaining words. Okay, the remaining part of the sentence and see if that is grammatically correct. Now let's read it. I am writing to refer Miss Vineyard, who requires supportive care and management. Is that correct? Without reading this, if you read everything else, if you feel that it makes sense, then it's good. So here you have to say a 6-week pregnant woman, a 31-year-old male, a 1 month old pregnant, or 1 month pregnant. Okay, so something like that you can write down. Okay, so you are giving the definition between 2 commas. This is a complex sentence actually.
Okay.
All right, good.
Yes.
Okay, let's go to the next one. Okay, so oh, you didn't finish it. Okay, from your facility after her discharge today. That's good. It's grammatically correct. But this one, okay, you could have removed this one. Otherwise, what you could have done is, I'm writing to refer Miss Vineyard, who is a 6-week pregnant woman. Okay, it must be A. There is another way to easily remember the spelling. Remember, okay, let me give you the clues. Okay, see, woman. Okay, woman. All right, and then the next one is women. isn't it? So how do we know which one is a singular noun and which one is a plural noun? It's very simple. There is a very easy strategy that you can apply. Okay, see this one. Among these both words, okay, the spelling can be of great help for you to find out which one is the singular noun, which one is the plural noun. Look at this A. A is the first letter, isn't it? A
Yes,
is
sir.
what? A is the first letter.
letter.
First letter in English, isn't it?
Yes.
What is one? One is what? First is what? It's a singular noun, right?
Yes, yes, sir.
Okay. E is what? E is the fourth letter. A, B, C, D, E.
Fourth
Sorry,
letter.
fifth letter. Fifth letter. Okay. E is the fifth letter. What is five? Five is a plural noun, isn't it?
Yes, sir.
Simple. It's easy. It's so easy. The same thing is applicable for men and men as well.
Okay.
See, M-A-N. Okay. So the difference between them, the spelling can be of great help. It's very easy to remember. So men among M-A-N, A is the first letter again. So A is the first letter in English. So it's very easy to remember. Okay, so you don't commit the mistakes once again. So A
Okay.
is number one. Okay, it's the first letter. Okay, it's number one. Okay,
letter.
whereas E is what? E is the fifth letter. Okay,
Fifth letter.
five is what? Five is definitely a plural noun, right? Five means
Plural,
more
yes.
than one. Yes. So when you write down a 6-week pregnant woman, okay, it must be A.
Okay, sir.
All right.
Yes.
I hope you understand this one. It's very
Yes, sir.
simple. See, there are several strategies behind remembering the correct spelling of words. Okay, for non-native
Okay.
speakers, all right, for non-English speakers, knowing the spelling is really critical, because if you have to write down the correct spelling in English, you need to know this accurately. Okay, especially for
Okay.
writing section, it is going to be assessed, with more attention. So the examiner is going to look at your spelling, and then they're gonna assess your words and everything. So if you commit many spelling mistakes, you are going to get a lower score. Okay, so that's really
Okay.
important. So for the people who have joined recently, Punita has written on an incorrect, spelling for women. She has written on 6-week pregnant woman with the E. Okay, women, WOMEN, but that's wrong. She thought it is the singular noun, but it is unfortunately a plural noun. So the way we have to identify is that you can use the spelling of the word, okay, to distinguish. Okay, look at this one, woman, WOMAN, A and then E. So these two are the two different letters in these words. All the other letters are the same, isn't it? WOMNA, everything else is the same, but only A and E are different. Okay, when you look at A is the first letter in English, which means it's number one, whereas E is the fifth letter in English, isn't it? A, B, C, D, E. All right. So E is the fifth letter. Five is the plural noun. Simple. So women, WOMEN, is a plural noun, whereas WOMAN is a singular noun. The same thing is applicable for men as well. Men and man. Okay. I hope you guys understand this strategy. So applying these strategies can help you out to get the correct spelling for all the words. Okay.
Okay.
Right. Okay. Let's go to the next one. All right, so this one is okay. She has been diagnosed with the substance abuse during pregnancy. That's good. That's good. I'm happy with that. So apart from these couple of mistakes, everything else is all right in the introduction paragraph. Okay. Miss Vineyard self-admitted to hospital 2 days ago. It's better to use, the numbers like 1 to 10. I mean, below 10. In terms of words. Okay, for example, instead of writing down 2 days, it's not a grammar mistake. Okay, it is just a recommendation only. Okay, you can write TWO. You could have done that. Okay, it makes your letter even more formal. All right.
Okay.
2 days ago with the concerned about her pregnancy. No. She's okay. Miss Vineyard self-admitted to hospital 2 days ago with the concerns about her pregnancy. It's not with the concerned. Concerned is a verb. Are you willing to write down a verb? Would you like to convey, the verb, the action here? No, it is the noun. You should have used the concerns about, isn't it?
Okay.
Right? It's not concerned about. That's wrong, unfortunately. So it's concerns about. Another best way to deal with the inappropriate use of nouns and verbs is that in every sentence you can go to the subject and find out the subject. Miss Vineyard is the subject, okay? And then
Yes.
what you should have done is that you should have read this properly, like Vineyard, Miss Vineyard self-admitted, that's good, to hospital 2 days ago, that's right. With the concerned about her pregnancy, this is wrong, because with the concerns about her pregnancy. So you need to proofread the sentences, okay?
Okay.
Against the most common mistakes you commit. All right. She had the complaints of low back pain, tingling in feet, trouble in sleeping, and delusion. That's good. In addition, you don't need to place an hyphen here. It's wrong. So do not use hyphen unnecessarily. Don't say in and then hyphen and then addition. Okay, that's wrong. You have to use in
Okay.
addition, comma. All right.
Okay.
She lost 6 kilograms of weight. She lost 6 kilograms of weight over the last 2 months. Okay, that's good. Put a full stop close to months. Okay, close to yes. Don't put it
Okay.
like between these two words. Okay, these are all the same thing is applicable here as well for delusion. After delusion, don't put with the too much gap in between. It's not good.
Okay.
Okay. See, similarly,
Okay.
this comma as well. You know they need to go close to the previous word. Okay.
Okay.
All right. So during hospitalization, she was monitored acquired immune deficiency syndrome. She was monitored for, isn't it? It's not she was monitored, acquired. So you used, two verbs here. If you don't use
Okay.
for, okay, acquired can also be considered as a verb, and then monitored is another verb. So you can't use those two verbs together. So she was
Okay.
monitored, acquired. Okay, that's wrong. So monitored for acquired immunodeficiency syndrome. Okay,
Okay.
that's good. And sexually transmitted diseases, as well as she was counseled regarding the same
Council.
along with the nutrition. Okay, so again, this is wrong. This is wrong. This is spelling mistake. Okay. You could have mentioned as well as she received counseling or guidance regarding the same along with the nutrition and pregnancy. Anyway, that's all right. Counseled, there's a spelling mistake. I will tell you what kinds of spelling mistake you have done. You should have used two what do you say 2l. Okay, so counseled is wrong. See this one, can you see that? Double L.
Yes.
Counseled. Okay. All right, let's go to the next one. Counseled regarding the same along with the nutrition and pregnancy. That's good. Apart from this, there should be a comma. Apart from this, there should be a comma. Apart from this, okay, you should say apart from this, comma. Okay, sorry.
Okay.
Full stop but comma. Okay, good. All right. Apart from this, she has been recommended to join the rehabilitation clinic for driving out. Okay, that's all right. Driving out, yeah, that's good. I'm happy with that. Miss Vineyard lives with her friend and has no contact with her parents. That's good. She has habits of, see this one, is an article for the singular noun only. You can't use it with the plural noun. This is wrong. Habits is a
Yes.
plural noun, right? So it's wrong.
Yes, sir.
So
That.
she has a habits of. That's wrong. You should say has a habit of. Okay, that's it. Has a habit of. Okay, drinking, alcohol, smoking, and drug. Okay, see this one. This is the verb in relation to alcohol. I mean, alcohol can be drunken. Okay, so she drinks alcohol. Okay, and she smokes. Okay, that's good. What is this drug? And use. Okay, you should have mentioned habit of drinking alcohol, smoking, and using drug. Right?
Okay.
So drug alone doesn't make sense. And using drug. All right, that's what you should use. Using drug. Okay, so what's the next one? Let's say she has a habit of drinking alcohol and what is this? Become teenage. So when she was, started from teenage itself, isn't it? Is that what you want to say?
Yes, sir.
So
Yes,
when
sir.
she was, okay, All right. Okay, so let's say become teenage. That's wrong. So what you should have done is since her teenage. Since her
Since I am written first, then I
teenage.
strike it.
Sorry, I have written on double hair. Yeah. Okay. Yeah. So you have written on since her teenage. Since can be used with the her teenage. That's fine. I mean, it's a time
Okay.
from there. So that's all right. She uses.
Okay.
So this is wrong. Okay. This is a completely an incorrect sentence. She uses cannabis. Okay, or whatever the amphetamines and then cocaine and heroin. Please note sometimes she shared infected equipment. So is that the previous one? So she did it in the past, right?
Yes.
After sometimes you need to place a comma as well. So it's like please note comma and then sometimes comma. Okay. All right.
Okay.
So sometimes comma. And try not to use the same words from the case notes. If the case notes have got sometimes, you could have used occasionally. All right.
Okay. Occasionally only in the case note.
Or then you
That's
can
why
use
I put.
sometimes. That's fine. Yeah.
Yeah.
So try to use at least some synonyms. Okay. It's much better. It's
Yeah.
highly appreciated. Okay.
That
Despite
in
having
the case note there is
yeah.
occasionally.
Okay. Good. Despite having suicidal thought. Is that social thought? What's this?
Suicidal.
But suicidal, that's what you have written on. So the spelling
Uh,
is incorrect. It's very bad. Okay, it's not. Yeah, I thought it's a social thought. Okay, it's suicidal. Okay, it's actually okay.
Suicidal.
So the way you have to write down is suicidal thoughts. Okay, simple. All right, suicidal thoughts. All right. She never consulted a psychiatrist. Okay, that's good. It would be greatly appreciated if you could visit Miss Vineyard daily for next 2 weeks. For all the duration, you have to use the before that. So for next 2 weeks, for the next 2 weeks, for the next 1 week, for the next 10 days, for the next 2 days, for the next 1 year, or so on. Okay, so it's better to use the before that. Okay.
Okay.
All right, what's the next one? It's here. Kindly provide psychological support for depression. Please encourage her to join methadone program, Alcoholics Anonymous meetings. Okay, right. Okay, so instead of writing down the active voice, like for example, kindly provide psychological support for depression, and please encourage her to join methadone program, Alcoholic Anonymous meetings, or whatever it is. So what you could have done is you could have used the passive voice. For example, providing psychological support for depression is important. Okay, providing, for example, you can say after that, you can say also providing psychological support for depression and encouraging her to join methadone program or Alcoholic Anonymous meetings are equally important or are vital. Do you know what I mean? So you could have used those kinds of passive voice structures, please. Okay. But there is no grammar
Can you
mistake
tell me
here.
once more, sir? Can you tell me?
So it's like providing. Okay, let me write it down. See, providing psychological. So I'm gonna add also before that. Okay. Sorry. Shouldn't use capital letter. Sorry. Also providing psychological support for her depression and encouraging her to join. Right, what's the next one? Encouraging her to join methadone program. Okay, methadone program. All right, methadone program. Methadone program. Is the alcoholic meeting different from methadone program?
No.
Oh, it's the same thing, right?
Yes.
Alcoholic meeting. Is that alcoholic meeting? Anonymous meeting, right? Alcoholic Anonymous. Okay, anonymous. Okay, anonymous meeting. Okay. Also providing psychological support for her depression and encouraging her to join methadone program, alcoholic meeting, are equally important, or you can simply say are vital or beneficial for her, or beneficial. Okay, something like that. You could have written down like this. Okay. Let's go
Okay.
through the next one. Okay. Please note she has a follow-up appointment at maternal health clinic for first trimester ultrasound scan at 2 weeks. It's not at 2 weeks, in 2 weeks. Okay,
Okay.
it's not at 2 weeks. At cannot be used with the 2 weeks. In 2 weeks.
Okay.
Okay, right. You are sincerely the registered nurse. Okay, you have written on 210 words. Okay, that's great. All right, let me go through the assessment now. One is task fulfillment is okay as it is within the word limit. So overall task fulfillment is all right. But grammar is not up to the mark. If you feel that you are not confident in one longer sentence, try to split it into two simple sentences. In that way, you should be able to,
Okay.
reduce the chances of mistakes. Okay. Use of prepositions,
Okay.
articles, nouns, verbs, punctuation marks could have been better because you have committed up the punctuation error after apart from this. Okay, so you should have placed a comma, but you haven't done that. Use of spelling is not up to the expectation. Okay, so you haven't spelled the words correctly, so that's not good. All right, use of articles, prepositions, everything. At 2 weeks, no, never. It never goes. Okay. You
Okay.
have got confusion between the concerned about and concern. Okay, do not use the hyphens unnecessarily. All right, vocabulary is okay, it's not that bad. Connectivity is fine as well. You could have used passive voice form more frequently and appropriately. Okay.
Okay.
All abbreviations were expanded. I'm happy with that. That's good. Presentation and layout were all right. That is also good enough. Okay, what's the next thing we need to be worried about? Okay, I need to go through the case notes now to see if you have included all the relevant case notes or not. Okay.
Okay.
All right. Okay, that's the first page, I think. That's the
Second page.
Oh, okay. That's the second page. No, this is the second page. That's okay. Let's go through from here. So, using the notes, write a letter about Miss Vineyard's situation and history to new community health nurse. Okay. So, you need to write it down to the new community health nurse. So, the health nurse doesn't know anything about, Vineyard situation. Okay.
Yes.
Address your letter to Miss Lucy Ben, registered as Community Health Center, St. Kilda. All right. Okay. No worries. Let's go here. Okay, so these are the case notes. Read the case notes below and complete the task notes. Miss Amy Vineyard is a patient in your care at the St. Kilda Women's Refugee Center. She is 6 weeks pregnant with her first child. She presented 2 days ago requesting help for her substance abuse problems. She reports a desire to reduce or cease her alcohol consumption and a desire to cease her drug use. No desire has been indicated to decrease or stop cigarette use. She now wishes to be discharged but will require ongoing support throughout the pregnancy. Throughout her pregnancy, so ongoing assistance. Okay. All right. Discharge summary: Miss Amy Vineyard, 21. That's fine. Admission. That's okay. Pregnant, substance abuse. Yeah, 8. So she has been discharged. like in 2 days. Okay, so on 6th she was admitted, and then 7th, and then 8th. Okay, all right. Community mental health nursing required daily next 2 weeks minimum. Okay, minimum. So you should have mentioned at least for the next 2 weeks. You should have used the words at least. Okay, even you have written on the
Okay.
second page. I think it was missing.
Okay. Yeah.
So minimum. Okay, so you should have mentioned somewhere here at least. Okay, at least for the next 2 weeks. Okay, that could have been done. So you didn't include that. Okay, you can, because that is really important. When they say minimum,
Okay.
it is really important. Okay, you have to mention that. Patient
Yes.
wishes to continue living with a friend on a sofa. Psychiatrist support needed for depression. Methadone program, Alcoholics Anonymous meetings. Okay, 1 trimester ultrasound at 2 weeks. They use incorrect prepositions and articles. Unfortunately, they don't use articles at all sometimes. Do you know what I mean?
Yeah.
So you are the one who needs to find out whether it is a correct use or not, and then you have to change
Okay.
it if it isn't correct. Maternal health clinic appointment needed. So did you mention this one in your letter?
Yes, sir.
Okay,
My
good.
turn. Yes, sir. That is appointment.
Okay, reason for admission: self-admitted due to concerns about concern. You can see this one, concern about. Okay. You could have, instead of writing down due to concern about, you should have mentioned, you should have changed this verb noun form into a verb form. For example, you can say Miss Vineyard is concerned or was concerned about her pregnancy, was concerned regarding her pregnancy and was self-admitted to the hospital. So you could have mentioned, okay, she could, otherwise she admitted herself, okay, to the hospital.
That I written self-admitted.
Yeah, I mean, you should have mentioned using different words. I mean, different synonyms. Okay, confirmed
Okay.
pregnancy test the days. So that's all right. Reported pain in the lower back. I think you have included that. Weight loss.
Yes.
That is not good. That's a negative thing. All right, you have included that as well.
Yes, sir. The
Okay,
last.
let's go to the next one. Yeah, some memory loss, tingling in feet, sleeping difficulties. Okay, so excessive worry and hallucinations, feeling depression, depressed. Okay, history of depression. No pain in hips and joints. That's not needed. Apart from that, she doesn't have many. I mean, she doesn't have any remarkable medical history. Okay, good. Patient monitored. I think you have included these things, isn't it? Memory loss. Am I right?
Yes.
Yeah.
That
Did you
memory
include?
loss I am not written, but
You should say I have
hallucination.
not written.
Yes.
Yeah.
Yes.
Memory loss
Yeah.
is also important, isn't it?
Yes.
Because she needs to ensure that she takes the medicines on time. So the other nurse needs to know that as well. I mean, if she, whether she takes the tablets or not on time or not. So memory loss, means if she forgets, then there is an issue. All right. So you should include this. If you didn't do that, it's wrong.
Okay.
Feeling depressed, that's okay. All right. These things are good. Patient monitored and blood tests for HIV, AIDS, and STDs. That's good. Consulted regarding nutrition, pregnancy. Yep. All right. Instead of writing down nutrition, you could have used diet. Okay.
Okay.
Yes, you should have used at least some synonyms. All right. Consult. Okay. She received guidance or advice. Something like that. All right. Okay. Discussed possibilities of rehabilitation clinic for driving out. You have used almost all the words from the case notes. You have just copied and pasted over there. It's not good. Lifestyle decoding. Okay, she has a habit of excessively smoking. It's too much, isn't it? 30 to 40 cigarettes per
Yes,
day.
sir.
Started smoking at 15 years when she was okay. Drugs used. These are the ones started about. Okay, injects heroin occasionally. She has infecting human. My God, that's not good. Alcohol 18 units a day. Maximum units is, oh my goodness, 15. This is too much. So you should have mentioned these phrases like excessively. I mean, she has the habit of excessively, or you can say excessive smoking and drinking or something like that. You should have mentioned it over there. Okay, it's too much. Or she has been addicted to smoking. You should have mentioned those kinds of phrases. Okay, do you understand? It's
Okay.
an addiction,
Okay.
actually. Addiction to alcohol, smoking, and these drugs. You could have used those words. Okay, addicted. She has been addicted to blah blah blah. Okay. All right. Lives
Okay.
with their okay friend. That's all right. It's on the sofa. You should have mentioned this one. So did you mention this?
No.
No. Okay. You should have done that on her sofa because for a pregnant woman, I think sleeping position is really important. So you should have mentioned it in your letter. All right. No contact with the parents, everything else is all right. Suicidal thoughts. Okay. As there is no contact with the parents, I think it's better for you to mention that family contact. If the nurse arranges the family support, okay, by contacting them, that would be of great help. All right. I think it's indirectly told. You could have mentioned this.
Okay.
All right. No worries. But apart from that, I think it's okay. Never seen a psychiatrist. Okay. All right. I think everything else, I think one or two notes weren't included. I mean, one or two points or words you can say, but most of the case notes were included. I'm happy with that. It's not that bad. Okay. So I think one case note and appropriate word weren't used properly. All right.
Okay.
That's one issue. Because you should have mentioned those things, addicted to, and then what do you say? These ones. There's another one.
Memory loss.
Yeah, memory loss, all those things. Yeah. Okay, looking at the mistakes that you have committed and their frequency plus the severity. Okay, to me, this one can get you perhaps 280 maximum.
Okay.
All right.
Improving day by day.
Yeah, definitely. Yeah, you have been improving, but yeah, please try to commit. Try not to commit the same mistakes again. Okay.
Okay.
All right. Thank you so much.
Okay. So thank